All right. Welcome to the High River District Healthcare Foundation social media. My name is Jody Seeley, and it is round number 2 of our conversations of rounding up mental health in our community. And today I'm so excited. I get a whole party. Like, look at everybody who is joining us today. This is going to be so much fun. Please help me welcome Shelley Koot. She is the manager of community support services and is with the Foothills Community Counseling Center in High River. We have Joanne Dzurka with us with the PCN Mental Health. She is our team lead for the Calgary Rural Primary Care Network, in case you're not sure what PCN stands for. And we have Teresa Ferrario, who is our Minds Matter manager. That was a really hard one with the Foothills School Division joining us today. But I love all the alliteration, Teresa. That's awesome. Ladies, thank you for coming to have coffee and chit chat about mental health this morning.
Thanks for having me.
I don't know. I think I'm the only one that gets so excited and jazzed about, like, let's talk mental health. And people are like, what? I want to just start a how's your five conversation with you guys today, but we're good. But the purpose of our conversations is the funds that are being raised with the Cattle and Grain Roundup with the Hospital Foundation this year are going towards a mental health focus and focusing on bringing conversation, awareness, programs, the whole gamut into supporting mental health in our rural communities. And so you three ladies are, I want to say, in the thick of what's happening with mental health in our communities. You're seeing a lot of people who are going through a variety of different elements and just wanting to dive in. So I'm going to throw out some questions. If you feel like you want to answer first, go ahead, but hoping to hear from all of you when it's applicable today. But I wondered if we could start talking about some of the, I don't know if we would call them trends. Would they be issues? What are some of the things that the youth in our community are facing when it comes to mental health? And knowing mental health is a pretty big umbrella, but what are some of the things that you are seeing in your space of work that's affecting our youth in today's climate?
You know, Jody, I might jump in on that one and just say that there's been a lot of studies done. And what we're really noticing is quite a peak in issues of anxiety and depression, and particularly anxiety in our children, youth, and young adults. And that's been through the pandemic and has persisted post-pandemic. So these are big issues that I think our young people are dealing with.
Yeah. And I think too, like, just to kind of start off, one of the biggest conversations that we have with Minds Matter and just the reason why we're even here is to reduce the stigma around mental health. And so first and foremost, everyone has mental health, right? And so I think that is the key piece that people have to understand, is that we all have mental health. And so when we look at mental health, there's such a diverse range, and it can go all the way from really healthy, strong, to, I'm really struggling with my mental health. Or it could even look like mental illness. But even with mental illness, somebody can be really strong with their mental health and be doing really well. So there is this whole large, what would you call that?
Continuum?
Thank you. A continuum of what that looks like. And so I think first and foremost, understanding that is super important. And then to look at some of the trends. Joanne, you've totally spoke around the anxiety, depression. We're seeing that across the board as well. In the last few months, we've seen a lot of interest and inquiry around bullying prevention, and we're seeing an increase in bullying. And when we really peel that back, it really comes down to connection and not feeling connected, right? So I think that's a large piece of what's happening. And I don't know if that's post-pandemic or what it is, but we are definitely seeing an increase in that right now.
I think what we see, it certainly falls under both of those as well. So I think anxiety and depression, but it's not typically how it's presented to us.
Mhm.
So youth are referred either maybe by parents or doctors or schools because they're seeing an increase in irritability. They're seeing an increase in withdrawing from things. So they'll often address the behaviors that they're seeing, and that's what kind of brings them in. And then you sit them down and talk to them and go, wow, these kiddos are under a lot of pressure. And that's when we discover that it really is high stress or that anxiety, which can lead to depression as well. And so that change in behavior that I think we're seeing, and I think the concerning ones are the ones where they're just withdrawing from typical activities, or maybe participating in more higher risk activities, so escaping on the other extreme ways. So and yet again, when we drill it down, it is typically that anxiety and depression is what we're seeing in our office as well.
Well, I think it's easy to say, like in our world right now, we've got a lot of moving parts, right? If you've watched the news for even 30 seconds in the last 6 months, you know that there's a lot of hot topics that are happening in our world. Our children aren't shielded from that. And so the things that we're feeling as adults going through, like, whew, like that 30 seconds of news has me feeling a little bit uncomfortable about the world. And then think of a brain that isn't developed at the same level of yours going through those same feelings, emotions, trying to digest a lot of that information. So I think sometimes as parents, we're like, oh, well, they don't know about that part. They know more than we think they do. And it's managing all of those pieces together. Do you find that, because we've come a long way in the conversation around mental health, and there's been lots of different, marketing campaigns from companies or just, working in the healthcare field, we have more language around it. We have more ways to describe some of the scenarios that we're feeling. And this awareness has created this conversation, but we're maybe still a little bit confused on what some of these terms mean. Would that be fair?
I think it's fair. I think the conversations have helped a great deal in the sense that it's kind of normalized it just to some degree. So when you hear athletes talk about it, or you hear men maybe talk about it who weren't talking about it before, I do think that helps open the doors to conversation. I do think there's some confusion perhaps on what are feelings of depression or feelings of anxiety versus a diagnosis. And so some clarity around that sometimes, that people might be fearful of what that might mean, but it's always a great starting point to have the conversation and let's talk about it.
Yeah, I'd agree with that. I was thinking about something else when you were talking, but that's why now I'm like, oh, brain shift. But oh yeah, because you were talking about like what was on the media and like what they're seeing and all the things that are happening in our world. But some of the other things that we're seeing across the foothills is housing insecurity, higher higher rental rates. Mortgages have increased in their monthly prices and are putting financial strain on families. The food bank is seeing huge increase in numbers, right? And so when you say kids aren't sheltered from that, they're seeing that family stress, they're seeing that financial stress. And you have to still show up and go to school every day, and you still have to do all the things that you're supposed to do, and yet what might be happening at home. So that's a big one too right now. Yeah.
And I would say, in conversations with my young adults, there is a tremendous amount of openness to talk about mental health. I'm noticing that just informally. But I think, Shelley makes a good point. Like it isn't always, people don't always have that finer understanding or that more sophisticated understanding of exactly what constitutes a diagnosis of anxiety or of depression or of both, in fact, because they're separate mental health issues, but they often go together. So, but I love that people are willing to talk about it. They're willing to own what's going on. And that just opens that door to make it easier to support them for sure.
Yeah, which I think, it took us a long time to get to this point, and just we're going to keep moving forward, which I think is great. Now, when it comes to supports for youth in our communities. I want to take a few moments to have you guys each talk about some of the things that you have from your each facilities, things that you know of that we can access to support our teens and our young adults. And I think often, if your child is experiencing something, or for any of the young adults who are watching this directly, and you know that you need to get a little bit of extra support, it's often confusing. Where do I go next? Like, identifying and admitting and even saying it out loud is one step, but then what happens? So if each of you could take a moment and just sort of share what you know or what you're doing to help support the young adults in our community.
Yeah,
Sure, I'll go first. I was like, yeah, prevention. So Minds Matter is all about prevention, right? And so we come in and we educate in the schools, and we're in specific designated school sites, but we really just lay the foundation. So understanding your emotions, being able to identify and actually have names for them, understanding the stress process, understanding how your brain works. We do a lot of education around that in the schools. We are seeing a gap with what our young people are learning versus when they go home and maybe what the community or their parents know. And so something that we need to look at is how do we bridge that? So that's been a conversation that we've been having. But so that's one of the resources. And then obviously with a school lens, the family school liaison is always a great resource. But then we actually refer out a lot. So we do refer to, the Greater Foothills Family Resource Network a ton. They are fantastic. They're amazing. The Wild Rose, Salvation Army Food Bank. We do partner with them at Christmas time. And we have access to like Connect Teen, where we try to tell kids, or the Kids Helpline. But then the biggest one around, when you're struggling with your mental health, is Access Mental Health. And that's through AHS, and the phone number, it's one phone number, 403-943-1500, if I'm not mistaken. I'm pretty sure that's right. But yeah, and that's kind of like the point where I try to refer most people to. And I think that's one of the bigger numbers for us.
And sorry, just before anybody else jumps in, Teresa, which schools are you in?
So we have designated coaches in, it's Okotoks Junior High, Senator Riley, CIM McLaren in Diamond Valley, and Millerville. So right now, that's where we have designated coaches. And then we try to support the division with some supplementary support, so they can always access us to get some programming or some ideas. But those are the schools that we do support, Corley. Yeah.
Perfect. Thank you. Next.
Shelley, I'll jump in then. So the easiest way, I think, to explain the Calgary Rural Primary Care Network is to say that we are an organization that supports local doctors. We cover a really wide geographic area. So we go all the way west to Bragg Creek, east to Strathmore, and then all the way south to Claresholm. And so we would be covering all of the communities in that area. And often when people are experiencing mental health concerns, their doctor or their family doctor is the first person that they talk to about that. So I have a team of 11 staff, a couple on mat leave at the moment, but we cover all of those docs in their clinics, and we provide a free voluntary resource. It's counseling services and resource. So connecting, much like Teresa was talking about, where you might connect people to other services to help people manage. We will see people as young as 7. And if there are children younger than 7 and parents are concerned, we have our counselors will talk to parents about parenting strategies to support those younger kids. But 7 to 17 and beyond, all the way across the life continuum, we're here to support people's mental health. Generally, we'll do about 6 sessions, but we do see people longer than that if that's indicated. And again, if we need to, we refer on. So the way you get to us is just to ask your family doctor for a referral, and we take it from there.
Awesome. All right.
Yeah.
Thank you.
Perfect.
And
Um,
Shelley?
I always say that we're extremely blessed in our region. We are so resource rich. And so we have a number of great organizations. Both Teresa and Joanne referred to some of them that we can refer to. So our local agencies and organizations, our informal supports in the community can also provide a really great support for children, especially if it's their first time asking for help. So if they have a coach that they trust, if they have an uncle or aunt that they trust, a teacher, of course, is often notified there, but or somebody through their church, whatever that might be. It doesn't always have to be a formal support to get them started. But it's just important that they're talking. But through our program, so when Jody, through your introduction, said the umbrella department is community support services. So we do have the Greater Foothills Family Resource Network, and that supports families that have children 0 to 18. So they can provide parenting support. If there's parents that are struggling with their youth and just want to talk about that, that's an option. They also have through there a grant to fully subsidize all of our counseling for children and youth in the Greater Foothills region. So that is High River, Foothills County, as far south as Claresholm, and then all of Vulcan and Vulcan County as well. So it's a large geographic area. And so any youth that are referred to the program, and that can be self-referral from families, or it could be a doctor or through the school. Those services are all subsidized, which is great. And we have a few counselors that can work with children as young as 4 with some play therapy techniques, which is great. But for youth, we certainly welcome them to come into the program. So our services are available on site in High River, that's located in the FCSS Resource Center. We also have phone and video options available as well. And that can be great if transportation's an issue or timing is an issue. Just nice to have those other options. And then we would make referrals as well to other organizations. So BGC of the Foothills has a wonderful youth program, and they can do some one-on-one and some group work with youth. We work with FCIS as well if there's youth who are new to High River or new to the country, and have some support and partner that way. So lots of options. But yeah, through Foothills Community Counseling, we will gladly welcome them. It's sometimes the wait list issue, but we're always working on that and trying to make sure that we see youth as soon as possible.
That's awesome. Well, I love knowing that there's the video options or the other ways to connect in, because I know one of our big service communities that we support through the foundation is the community of Nanton. And often they feel like maybe they don't have the same resources as other communities. And obviously you guys sort of branch into those spaces, but just knowing and highlighting to our constituents in Nanton that, yes, even if this is located in High River or has Calgary in the name, or, isn't specifically in a Nanton school as of yet, those elements and supports are reaching out into that community. Because I think when we get rural and when we get smaller into community, we often feel like we don't have the support and the programs. And it's very obvious chatting with the three of you that there's a lot of options for all of the communities that surround sort of the bigger ones.
Just a quick comment. We had thought during the pandemic, of course, that's when a lot of us switched to video and phone, that would really die down afterwards. And it didn't, I think, just because it removed so many barriers for people who maybe had accessibility issues or whatever that might be. But what we did find is youth transition to in-person as much as possible. And I don't know if that's because they already spend so much time on technology that they wanted that in-person contact. So while it's available, what we find is most of our youth do want to see us in person.
Yeah. No, and I love that. It really speaks to, what Teresa talked about earlier in that, youth, adults, it really doesn't matter the age. Our desire for connection is so strong, and it's such a great piece. And knowing we have so much opportunity within the community. And Shelley, I also really loved you talking about the non-formal supports. And sometimes we lose sight of just being a community. Maybe somebody watching is like, well, I don't actually have a young adult in my life right now, maybe this doesn't pertain to me, but you might be one of those just great community members that is that informal support for somebody. You never know. You could be in a store and you notice a young person having a rough time or being in a tough space. And we as community members also have this really great opportunity to connect with other people in the community and not be afraid to do so.
Agreed.
Yeah, that's so huge. Like even just smiling, right? Like if you think about just randomly seeing a stranger and just saying, "Hey, good morning," how often do we do that to youth, right? Like a lot of times there's this perception that, ooh, youth, they might not want that, or, ooh, that's scary, or there's a big group of them. Like, I don't know, right? But they're just like us. Like we want smile, or they want smiles. They want people to, engage and want to have conversation with them.
Yeah, having a teen son, I can say they don't want you to acknowledge them and smile, but they also really love it. But
Really
that shift of like trying to be cool, that's a fun stage as a parent. Yeah. I appreciate that. Ladies, is there anything else that you wanted to mention or say, or is there some phone numbers or websites that we should maybe give out to people as a resource, or where they can start even just grabbing some of this info we talked about today?
Shelley or Jody, sorry, one of the things I would say is that sometimes these conversations will cause people to have thoughts or feelings that are uncomfortable, that are concerning. So if anyone is concerned about themselves or somebody in their lives, whether it's a youth or anyone at all, the Distress Center is a beautiful phone number. It's available 24/7. You can call for support. You can also call for information and resources, and we give that out all the time. So that number, there's a few ways to reach them. There is a website, but that number is 403-266-4357. And there might be other easier ways. Teresa, Shelley, any thoughts on? I'm kind of old school, and I always use that old phone number. It works.
There's the new 988 number is
yes.
Yeah. So they refer to it more as a suicide kind of assist a line, but really they will make connections to any of the supports that you need. So in a pinch, we use the Distress Center a lot, but the 988, easy to remember. You can text with that line as well, and not just phone. So if you don't have a data plan or you don't have that option, that's a nice way as well.
Yeah. And there's quite a few different options, but yeah, those are solid ones. And yeah.
And Joanne, you mentioned it. I think your doctor as well, right? So I think talk to your doctor about it. They'll make those appropriate referrals.
Yeah.
And something like what Shelley was saying is we are actually really resource rich out here. But part of that resource rich is I think that community organizations and towns, they actually really try to work together. And that's not something you always see. And definitely I spent the majority of my career in an urban setting, and it was so cool to come out here and start working in this area just to see how everybody kind of comes together and tries to fill gaps and support each other. And so even if you go to a place that isn't what you need, I would say that they are going to try to find you where to go, because that is just how it works out here. I just love it. Yeah.
That's great. And then I think, Jody, maybe it's just a few, just some tips for people just to watch out for. So just be aware if you see a change in behavior, and don't be afraid to not to judge it, but just come at it from a place of really compassion and just wanting to understand where maybe that's coming from. So just being aware of that. I think being aware of the expectations that we put on young people, because that's often what we hear is leading to anxiety, whether it's expectations around appearance or expectations around school or expectations on being able to handle mom and dad's divorce better than they can, whatever that might be. So I think just managing that. And then I think as much stuff in reality as we can present them. So just being present now, I think is really important. There's so much that isn't reality that we're faced with. And so doing something together, having a meal together, going for a walk together, just staying present and connecting, I think. And then maybe it's even going as far as setting an example. So if you're struggling yourself as a parent or an adult, to reach out for help as well, and be a good role model of it's okay to ask for help, and it's not so scary. So those are just, I think, maybe some tips as well that can just, we can't see everyone, but we know there's lots of kiddos out there that are struggling.
I love those. Thank you, Shelley. Anything else? And I'll throw some of those tips up as well onto our social media in case you're listening and working and not able to write down. Those are some great tips. So we'll share those onto our socials as well so people can kind of continue that conversation. But I just want to take a moment to thank each and every one of you for doing the work that you do. You know, not always is it sunshine and roses and beautiful things. You work through the trenches with a lot of the young adults in our community and their families. And there's also really beautiful moments in that. And so each and every day is something different. And we appreciate the work that you and your teams show up to do in our community every day. So thank you so much for all of that. Please take that thanks to your teams as well. And thank you for your time today. I know that it's not always, you're leading by example in facing a fear. I don't think any one of you wanted to come live and chat today, but you showed up and you did. And I'm so proud of you and so thankful for your time this morning.
Great.
Thank you, Jody.
Great. Thank you.
Great job.
Thanks
All
for
right,
having
ladies,
us.
thank you again. Thank you for being a part of our conversation. And we just look forward to continuing having more conversations, rounding up mental health, and be sure to share like the numbers we shared earlier and different websites. Share those on your social media. It's a really easy way you can just do a post about, hey, if anybody is feeling kind of stressed today, don't forget we have 988. And even putting that on your social, you have no idea who is going to see that and might have needed it in that moment. And even like we talked earlier, just smile at somebody today. That's a really easy thing to do. So have an amazing rest of your day. And ladies, thank you again for joining us.
Thank you.
Thank you.